This lecture will be divided into two parts, each lasting approximately 25 minutes. The lecture is on where health educators are often found doing health education. It's designed to help you review the different settings where you might be employed. It's also designed as a supplement for your textbook. In this slide presentation, we're going to look at the different roles a health educator might have in the different sites where a health educator might work. Typically, the role of the health educator is based on the regulations and policies of the organization, where the money or funding comes from for the organization, how is the organization funded, the philosophy of what health education is based on the 3 levels of prevention. Just to review, primary prevention are activities where you are doing items to prevent the disease from happening. This could be screenings, it could be a health fair, or it could be classes on nutrition, fitness, or sex education. Secondary prevention, those are preventions that are designed to help a disease from getting worse. So you might do screenings, you might teach one how to take their blood every 2 or 3 times a day for diabetes. You might be working with people who already have a sexually transmitted infection and teaching them how to have safer sex. And tertiary prevention typically relates to rehab, and this is after a disease has become chronic. You might teach someone how to manage a disease like diabetes or asthma, or you might help them through developing support groups where they can gather support or emotional support and learn more about their disease by participating in that support group. What a health educator does is often dictated by the audience, and that will make more sense as we move through this. And the role of the health educator also is influenced by the data that are required to prove success of programming. The first type of organization we're going to address is a health department. And health departments typically are funded through government dollars. Health departments are government agencies, and that means they are funded with taxpayers' dollars. Oftentimes, health departments get grants as well, but grants almost always are funded through taxpayers' dollars. Because you're using tax dollars in a health department, much of what you do is required to be transparent, and that means that outside persons can come in and evaluate and look at what you're doing at any time. For that reason, you want to be sure that the way you spend the dollars and how effective your programming is with the money spent is very clear and it's very effective. You want the population to look at your programming and say that was money well spent. In a health department, the philosophy of health education is often focused on primary and secondary prevention. Health departments often do outreach in communities where there might be risk factors. They might be in a school system and they might be doing health fairs. Or they often are involved in secondary prevention. And some examples of secondary prevention might be someone who already has heart disease and you're teaching them some ways to prevent it from getting worse. They might have high blood pressure and you're teaching them diet and exercise. They might have an STI and you're teaching them how to use condoms effectively. In the health department, your population will be the general public, and depending on the programming department in which you live at the health department will basically determine what you're doing. Typically, health departments are broken into different groups, like women, infants, and children, drug addiction, and so depending on what department you're in within the health department will determine who your population is. No matter which group you are actually working in within the health department, you have to go to the public. The public will not come to you. This means if you're working in a community where there's heart disease, you need to go into that community to do the education. If you're working with prostitutes and drug addicts who need education on safer sex, you need to go where the prostitutes and drug addicts are. They will not come to you. So that's a very critical piece of the role of the health educator in the health department. And the last item is the data that you will be required to collect. Most health departments require quantitative and qualitative data. Health departments have epidemiological departments, and they also have other departments that require data. In times of economic issues or economic distress, health education is often reviewed to see if that program will be eliminated. Therefore, the more data you have to prove that you are successful, the less likely you are that your job would be eliminated. Successes and failures in health department. First to discuss is the way to develop partnerships. Most of your teachers keep telling you how important networking is, and you actually will not believe how important it really is. When you get out at your internships, you will start to see how critical networking is. Partners with the health department. You often have partnerships between state and local health departments. You might have partnerships between two different states or among several states. You might have partnerships with volunteer agencies, which is the next thing we will discuss. You could be partnering with school systems, the NIH, or CDC. So the partnerships vary greatly in health departments. Because this is a funded program with tax dollars, it's critical that you work within guidelines, regulations, or policies. If you were to do something outside guidelines, regulations, or policies, it would be likely that it would end up in the newspaper or on social media. And you never want to be in the newspaper or social media for doing something wrong. You also have to produce data to demonstrate your successes, and that will be dictated by the department in which you are working in the health department. And PR, or public relations, and your image in the community is critical. If you are working in a Latino community and there are lots of first-generation Latinos in the community, you would really need to learn about the culture and respect the culture. And an example of how to get in trouble or have your program fail would be to go into that community and promote the use of condoms and preventing pregnancy and preventing STIs. That would be seen as very disrespectful as from first-generation Latinos to this country. And that one small piece of your program could actually ruin your relationship with that community for many, many years. It takes a long time to develop a positive relationship and a positive image, and it takes a very small act to destroy it. So you always have to be aware of how you are presenting yourself and the health department with the communities with which you work. The next organization is a volunteer agency, and most volunteer agencies are also tax exempt. Volunteer agency examples are American Heart Association, American Cancer Society, and sometimes governments have small volunteer agencies that exist within the health department, and that's done for a variety of reasons. These agencies are typically funded with tax dollars, donations, and grants. So again, the tax dollars and grants are typically tax money from the public. Grants may come from a foundation like the Bill Gates Foundation or Robert Woods Johnson Foundation. Or you could have a donation that's made by a big funder. And if, for example, a funder gives you $100,000 in a volunteer agency, they often give very strict guidelines on how that money has to be spent. So all of those issues mean that, again, in this agency, everything you do is going to be required to be transparent. So if someone were to come in from the outside and look at what you're doing in your programming and how you're spending the money, that they would feel comfortable with what you are doing. The philosophy of health education in a volunteer agency will depend on the agency, but it's often primary, secondary, and tertiary. In primary prevention in a volunteer agency, and I am going to use the American Heart Association as an example, they may go out in primary prevention and work in schools and teaching healthy eating and exercise. They may go into churches and teach healthy eating and exercise, or they may go into a community center and run a health fair. Those would all be examples of how a volunteer agency would do primary prevention. In secondary prevention, they may be working with a hospital or a clinic, and they may be working with people who have already been diagnosed with high blood pressure or high cholesterol, and they may be teaching them how to take their blood pressure daily, or how to exercise, or the types of food to eat to help regulate their blood pressure or cholesterol so it does not get worse. And occasionally they're involved in tertiary work where they are actually working with people who may have already had heart attacks or strokes and teaching them healthier ways of life. In the volunteer agency, you typically are working with the general public again, which means you have to go to your community. The community typically will not come to you. And depending on the funding source for the volunteer agency, that will dictate the type of data you need to collect to prove your successes, but most volunteer agencies will accept either quantitative or qualitative data to prove success. If you want to be successful in a volunteer agency, again, you have to really focus on partnerships. If you think about the examples I gave for primary, secondary, and tertiary prevention programming, those would be examples of places where you might have partnerships. You might have a partnership with higher education, with schools that are K through 12, with a health department, with religious groups. Your partnerships are going to be any type of relationship that will help promote your programming. Again, you have to work within policies, regulations, and procedures for the same reasons that I shared with the health department. You must produce data to demonstrate your successes, and your relationships with the community and other organizations are critical to the success of a voluntary health agency. The next setting in which you may be involved as a health educator is a healthcare setting, and that could be a clinic, an outreach center, or actually a hospital center. This group has the most regulated rules. They are regulated by outside agencies, and they are accredited by outside agencies. If they do not follow the strict regulations of the accrediting bodies, they lose their ability to practice that form of medicine. They also report to a board of trustees, which is often very strict. Considering all of that, the regulations that would affect the education that occurs will be very strict and will be guided by those outside agencies. The money or funding from a healthcare setting can come from the money from health insurance companies and payments. It can come from funding sources like a foundation, for example, Bill Gates Foundation, or they may actually get grants. However, no matter where the money comes from in a healthcare setting, they're very critical about how it is spent, and healthcare settings are businesses. They are required to make money. So no matter where the money comes from, they're still going to critique how it is spent and if it brings money or revenue into the hospital. The philosophy in healthcare settings is based mostly on primary and secondary prevention, but if it's a rehab facility, it could be tertiary prevention. Healthcare clinics and settings, even hospitals, have outreach. For example, University of Maryland at Good Samaritan in Baltimore City, they have an outreach program that goes into schools and local churches and teaches healthy behaviors to help prevent disease. They also have outreach that works with people who have already had diseases or risk factors, and they go to the same settings like schools and churches to promote behaviors to help keep the disease from worsening. And because they're a healthcare setting, they may do tertiary because someone may be in the hospital with a heart attack or stroke or some type of condition related to diabetes, and the education then would be helping them learn to manage their illness. The audience in a healthcare setting is different than the other two settings discussed because this audience, if they're in the hospital, they're captive. When you go in to do health education and someone is in their room, they are there. you go to them, but they're in a very localized place. The problem with this population, if they are in the hospital setting, is they are ill. And oftentimes they do not understand how important education is in returning to a healthier way of life. Therefore, the education may not be heard and may not even be wanted. So those are items that you have to get around. The data required in a healthcare setting is very stringent. They want data, more often quantitative than qualitative, and they want the data to prove that the program is effective and the money that was given to the program was well spent. Teams and partnerships in a healthcare setting vary slightly from other organizations because in a healthcare setting, you must have partnerships outside the hospital, like churches, community organizations, voluntary agencies, schools, universities, but you also have to develop partnerships inside the hospital. The health educator is in a unique role because the health educator has to get along with all components of the hospital. The health educator works with the clinicians, the doctors, the lab workers, the nurses. However, the health educator also might be doing educational programming for the non-professional staff, like the clerical staff, the food services staff, or the staff that cleans the rooms. So unique to a healthcare setting is how many different partnerships there are. Because the healthcare setting is so regulated, it's critical that you work within the regulations and policies. It's critical that you have data to demonstrate your successes, and your image in the community and within the hospital is critical to health education being acceptable and successful. The last setting that we will do in the first half of the lecture will be the worksite wellness program. Health educators are often hired to work in worksite wellness. The worksite wellness program will be dictated by the type of company, and the way it's funded will be dictated by the type of company. If you work in a worksite wellness program at IBM, the rules and funding will be different than if you work in a wellness program in a public agency like a school or health department, and that would be different than if you worked in a worksite wellness program in a hospital. So while worksite wellness has a general philosophy and belief, it also varies greatly by the type of agency or company within it exists. The philosophy for worksite wellness programs from the company's point of view is usually related to improved work performance or saving the company money. Although you may have a more altruistic view of why worksite wellness is important, the company almost always is interested in how your program will improve work performance or save them money. And the way money is saved is through the use of health insurance and how healthcare dollars are spent. Worksite wellness is almost always primary prevention. It has to do with working with the population at the site and making sure that they get preventive services that will help prevent them from getting diseases. For example, you may have a flu shot program. If you give flu shots at work, people are less likely to miss work from the flu. That would save the company a lot of money. Or you might do classes on nutrition and fitness to help prevent obesity. Or you might do stress management to help prevent stress. In secondary prevention cases, there will be a group of your population that has already developed conditions like high blood pressure or high cholesterol, and you may develop programs specifically for that population. And sometimes, in rare instances, in a tertiary area, when someone is diagnosed or is in rehab, when they return, you might be part of a care program to help them remain productive at the worksite. A good issue with the worksite wellness program is that you have a captive audience. The workers are there. As the Affordable Care Act has been implemented, many health insurance companies and work sites are requiring people to participate in health education and to demonstrate management of their chronic conditions. This increases the need for worksite wellness programming. However, you are going to have to be data driven in the worksite, because if there is a budget cut or the economy weakens, one of the first areas that's critical for cutting is the worksite wellness program. So you need to be able to show that your program is consistently improving work performance and saving the company money. If you can demonstrate that through data you collect, then you will be able to save your job and your department. Otherwise, worksite wellness will be an area that is typically cut in budget constraints. These are some examples of how to be successful. You have to know your population and their needs. So I'm going to ask you 3 questions and give you about 30 seconds to stop and think about what the answers might be. When I worked in a school system in the Worksite Wellness Program, we received yearly data from our health insurers on how our population was spending the school system's healthcare dollars. So these are 3 questions I'm going to ask you. The first one is, which disease do you think was most prevalent in a school system? The second is, which disease do you think cost the school system the most money in healthcare dollars? And the third one is, what do you think the main forms of prescriptions that were given to employees in a school system? So again, the 3 questions are most prevalent disease, most costly disease, and the third one, what were the top prescribed drugs? I'll give you about 30 seconds to think about that and jot down answers. Okay, the most prevalent disease, exactly like the major cause of death in the U.S., was heart disease. There was more heart disease in the school system than any other disease. The most costly disease was cancer, and any one of you who has experienced cancer in a loved one knows how expensive the treatments are to help someone get better once they have cancer. And the top drugs that were prescribed for the employees of the school system, the top 3 drugs were all antidepressants and anti-anxiety medications. So from that information, we now know something about our population and their needs, and then therefore we develop programming to address those issues. To address the cancer issue, one program that was implemented was mobile mammography screening. Now, I was in this position about 20 years ago, and 20 years ago, mammography was very difficult to obtain. Very few places did mammography. There were a few barriers to why women did not get mammography. One was they were too busy, and it wasn't easily accessible. And the other one is they didn't really like to go alone because they were afraid. To address that, we brought in mobile mammography units, and the units visited a variety of locations. We had 125 sites in our school system, so the mammography mobile unit would go to a variety of sites throughout a month or 2 in the school year. Women were also encouraged to go with a friend at work. So the fact that the mobile units were there and they were encouraged to go with a buddy, that increased mammography screening dramatically in the school system. And what happened was breast cancer was found earlier, and the cost due to breast cancer was reduced dramatically. So we were able to actually prove that. In regards to heart disease, we did a variety of things. One was body fat composition testing. We did fitness classes, we did nutrition classes, weight management classes, and those were all held at the site. So if school in northwest area of our location wanted a fitness class, we organized it, hired someone, and sent that person to their school. The data are very clear that people do not want to leave their site for any type of health education. So even though there might be a high school, middle school, and 2 elementary schools within 3 miles of each other, if the fitness class is at the middle school, well over 99% of the participants will be from that school. People are not willing to travel even 2 miles from their school to another site for a health education program. So the people would pay money, they would all pitch in, and we would charge enough money to actually pay the fitness person or the nutritionist. Another item we did regards to anxiety and stress was we tried to implement stress management programming. And oftentimes it was people participated in that, but they were much more likely to participate in the other items. And I'll come back to stress management a little later when we talk about PR. You have to work within regulations and policies if you're in a worksite wellness program. And an example that I'm going to give you of that is one of the activities that we wanted to do is our school system was divided into 5 districts. And so we were going to run a program that was based on fitness. And because we had 5 districts, we wanted to use the Olympic 5 rings. And you can't just use that. You have to ask permission. And we did ask permission the right way to use it, and it was declined. So if we would have used that anyway, the school system had the potential to get into a lot of trouble, and we would get a lot of negative publicity. So that's an example of a regulation outside the system that you actually have to follow. You have to know your worksite wellness's expectations, the organization expectations. An example of this was it was very clear that there were some attendance issues where I worked. So we collected data over a course of 6 months to a year on what the trends were. And they really were not surprising. In a school system, most absences occur at the elementary school, then the special ed school, then the middle school, and then the high school. The high school has the least amount of attendance issues. And that makes sense when you think about it, because when you think about which children are the sickest, it's elementary school children because their immunities are not strong enough. So the teachers and staff in those schools are exposed to more things than other people are. So we presented this to the senior staff at the school system, and despite the fact that they saw it, they did not want anything done about it. And they did not want anything done about it because they did not want to draw any negative attention to any of their schools or any of the districts. They didn't want to say, well, this district that has a lot of poverty-stricken schools has more attendance issues than this very wealthy district in the system. So despite the fact that there was an attendance issue that cost the school system tons of money every year, the upper management refused to address it, and that expectation had to be honored. We did not address it. We went back to it a couple of times, and there was eventually a program put in place that we were part of organizing, but there wasn't a big push to address attendance in the way you might expect a company to want to address it. You have to be able to produce data to support your programming. In the school system where I worked, we had over 13,000 employees, and we had $10,000. So we had less than $1 per employee in our budget. Despite the fact that we had such little bit of money, when teachers did not get pay raises or there was a pay freeze in the entire school system, we were always critiqued as to why we had $10,000 when that could be given to people in the school system. Even though it would be less than $1 a year, we were still critiqued. And so you need to understand that people are always going to be critical of the health education or wellness programs that you run, and data to support your successes are critical because that will help you maintain your programming and maintain your jobs. In regards to PR and public image, on the screen you see the words your and your. And I just want to tell you a story that would have basically destroyed our image in the school system if it had gone through. So every year we had a school-wide event, a system-wide event. It would last 1 week. Each day of the week would be a different focus. And at the end of the week on a Saturday, we had a walk-run health fair event at a local college. And we always had at least 3,000 people show up to that event. It was a huge event. So one year, one of the days, it was actually a Monday, I still remember the details. Monday of that week was going to be your special person day, and we had some materials that we were handing out to all the employees to encourage them to realize how special they were. And this was designed to help address the stress management issue and anxiety issues in the school system. So we hired these little fuzzy people, and they were called Weeples. And they were little fuzzy balls with eyes, and you could get a statement attached to it. And our statement was, "You're special, have a special day." I was in charge of ordering those, and when I ordered them, I spelled out the word your, Y-O-U apostrophe R-E, because I was very aware that that is a word that is misspelled often. So when the Weeples came in, we had 13,000 Weeples delivered about 3 weeks before the event, which was great because we had to count them out. We have 125 sites and over 10,000, about 13,000 employees, and we have to count them out so that each site gets the right amount of Weeples for their employees. So we open the box and start to count them out, and we realize that your is spelled incorrectly. It's spelled Y-O-U-R, and we are a school system. If we would not have caught that, or if we caught it and ignored it, and that went out with a spelling error, our programming would have lost all credibility in most of the school system. Senior staff would have been extremely upset. Parents who saw that would have been very critical, and the teaching staff would have been very critical. They would have just figured we were all incompetent. We don't know how to spell. So something that small as one word on a program that you use could actually destroy your credibility. It takes years and years to develop credibility for your program, but it only takes one very small act to destroy your credibility and your image with the public, whether the public is internal or external to your organization. So that is the last one in the first half of this presentation on different sites where you might work as a health educator. Remember that you have an online assignment related to this, and you can watch the second half of this presentation at a time when it's convenient for you.